Our second award is the Public Health Innovator Award, Farouk Meralli SM09. Farouk Meralli is a true public health innovator. In 2012, he founded the venture-backed mobile health technology startup, M-Clinica. First conceived while he was a student here at Harvard-Chan, M-Clinica is a mobile technology platform that connects pharmacies, physicians, and patients across Asia's emerging markets. In just the 5 years since its inception, M-Clinica has connected over 10,000 pharmacies across Asia, providing access to over 80 million patients and generating over 3 billion data records, demonstrating a reduction in the overall cost of medication by as much as 30%. Prior to M-Clinica, Mr. Meralli played key roles in product development and strategy at firms such as Pfizer, Roche, and Sanofi. Mr. Meralli maintains a deep interest in international development, as evidenced by 2 other organizations of which he is the co-founder. One is Borderless World Volunteers, a Canadian NGO with the goal of helping undergraduate university students lead development projects across the globe. And the second, Marine Ventures, is a Southeast Asia early startup incubator that promotes entrepreneurship in the region. Mr. Meralli has continued his connection to Harvard-Chan as a mentor by providing internships for a number of Harvard students. A true innovator, bringing the worlds of data science together with public health through scalable technology, the Harvard T.H. Chan School of Public Health Alumni Association is proud to recognize Mr. Farouk Meralli with the 2017 Public Health Innovator Award.
Thank you very much, and good afternoon all. So I understand that this is a mid-career award. I never thought at the age of 31 I would be considered mid-career, so you've given me lots to reflect upon. But I wanted to share with you a story about how I ended up here and what this school taught me along the journey. So I graduated in 2009, and the first thing on my mind was, how do I pay off the student debt? And so I took jobs at different pharmaceutical companies. I worked at Pfizer, I worked at Sanofi, and then I was working at Roche in San Francisco. And I remember this one moment where I was looking out at San Francisco Bay. It was a beautiful sunny day. I think I just had some $14 avocado toast and some organic quinoa. Life was pretty good, and it was very comfortable. But I looked at this blue body of water, and I said to myself, am I living my personal mission? Am I really doing what I set out to do for public health? Why did I go to public health in the first place? And the answer was no. And while we were doing great things at Roche, it was very incremental. I didn't feel like I was doing anything truly transformational. Truly, what I wanted to do was solve problems that no one had really tried to solve because they were difficult problems. And so I left about 5 years ago, and I moved to a country that I had never been to. I started in the Philippines. I didn't have a team, I didn't have technology, but I had this idea where we could connect thousands of pharmacies together and provide new sources of global health data to help both the industry, but also, more importantly, to help the public sector, governments and NGOs that never had access to this data before. And it was a very difficult journey, a journey that started in that country, but then we grew to across Southeast Asia, to Vietnam and Indonesia and other such countries. And after growing this network and producing all this data, I realized how difficult solving problems in public health was. But along the way, it was lessons that I learned here, skills and spirit that I both learned and that were instilled within me that allowed me to be able to face these challenges. And so I went from a situation where I was very comfortable, where life was very easy, to something that was very uncomfortable. And I think that's what public health is a lot of the time. We should be uncomfortable, because we should be uncomfortable about what is going on around us in healthcare and how we should spend our lives trying to solve these problems. Sometimes comfortable isn't a good thing. And I think I'd like to thank the school for giving me both the passion and the purpose to be able to go after these very large problems and try to do things that are transformational and not just incremental. So I would encourage you all to not be so comfortable. So thank you very much.